afternoon, everyone, and thank you for joining me today for our webinar on special premiums and CMEs. Now, I know some of you are thinking that there's no more CMEs, so there are for some of you in certain situations, so we will speak briefly about that as we go along, and hope that everyone is able to follow along nicely and get as much out of it as possible. We do have a lot of new members on today, so thank you very much for joining us. If you do have any questions, please do write them down. My contact details will be available at the end of the presentation, and you'll be able to either give us a call or send an email with your questions, and we'd be happy to answer any of them that you may have. So let's go ahead and begin. So a little bit about CIRRUS for those that are new to our webinar series. We're founded back in 1994. We're a small boutique consulting firm located in Midtown Toronto. We have a dental and medical office lease negotiation department, which is part of our business, where we do several hundred over the year, maybe even close to 1,000 now per year. And we help both doctors, dentists across North America with their lease issues, with dealing with their landlords and so on. And then my department, which is the healthcare consulting, we do billing support and operational consulting for both groups, individual physicians all across Ontario. No group too big, no group too small. We're happy to help anyone and everyone. So some quick facts about Ontario physicians today. Better compensated than anywhere else in Canada, although there are some cuts that are being talked about now, but still you are being paid better than anywhere else in Canada, especially in the FO model. There really is a great opportunity there for many family physicians. However, a lot of physicians say that their pay does not align with the care that they're delivering. So oftentimes we're finding that physicians are providing comprehensive care to all their patients, but they're not necessarily being compensated accordingly, whether they're billing incorrect codes or their codes are being rejected for some reason. That's where we come in to make sure that you, A, are billing the right codes, and if you are not, figuring out what codes to bill, and if they are being rejected or for whatever reason, then we'll make sure that we get the right code billed and make sure that we do get it processed. And Ontario physicians are generally not strategic in how they're paid. The FO and billing codes and everything like that can be quite complicated and confusing. So sometimes, some of the physicians just say, you know what, I know an A7, I'm going to bill an A7, and that's it. It's just easier. I don't have to worry about it. In some situations, yes, you could be right, but let us take a look and let us help you and determine what can be billed and when it can be billed to make sure that you are being compensated fairly for all the care that you're delivering. So the purpose of today's program is to get you a little bit better understanding of the special premium categories. Again, some of you may participate in all the categories, some only a few, but it's good to know what's going on across and what's available to you. And we'll investigate a little bit about the CMEs, how to properly bill them, those that do have a little bit remaining, and just a bigger, clearer picture of optimizing your practice through these income streams. So CMEs and preventive and special premiums are two of the categories that are available to you within the FO model that make up a small percentage, but still nonetheless it is available to you and income that should be earned according to the care you're delivering. So we want to make sure that you guys are able to capture as much as possible. So for special premiums, 8 categories in the FO, approximately $37,000 that it's available to you. And with CMEs, normally it's $2,400, but for this fiscal year, starting in April, only about $400 that's available to you. If you do have carryover from last year, then obviously it's going to be a little bit more, but that would be a more specific question. And if you did have a question about whether you do have carryover or not, again, my details will be available at the end, and we'll be happy to answer those questions for you. So let's go ahead and get started talking about each of the different categories that's available to you. So again, in the FO model, there's 8 that you can see there. If you're in a FIG model, and there's 5 different categories available to you that are in the orange. Once you move in, if you were able to move into the FO, then those blue categories would be available to you as well. And again, some of you may participate in more than one category, some maybe all of them. But again, we want to make sure that if you are providing this type of care to your patients, that you are getting the bonus available accordingly. So again, let's go ahead and speak about each of these. So hospital services, both to enrolled and non-enrolled patients, once you've hit $2,000 worth of services of these codes, and I believe there are a few others as well, there is a bonus level of $5,000 that's going to be paid out to you. And again, once you hit that $2,000 threshold, that $5,000 is kicked in automatically on your next pay cycle. For labor and delivery, now again, some of you may deliver babies, some of you may not, but again, non-enrolled or enrolled patients, so again, some of you do a little bit more work in the hospital, might be a little bit easier for you guys to do that. If you deliver 5 babies, $5,000. If you deliver 23 or more, $8,000. And again, those are the codes that are available to you for those categories. Office procedures. Now this is a tricky one. There's a ton of codes that are available, as you can see, and it's $1,200 worth of services that pays out a $2,000 bonus. Now this one is only for enrolled patients. So this is when you're doing sutures or liquid nitrogen or abscess removals or things like that within the office to your enrolled patient population that you'll be able to get this bonus. Again, once you reach $1,200 worth of services, again, a variety of these codes or any code combination, you will get that $2,000 bonus paid out automatically, again, on your next pay cycle. Palliative care. Now, again, this is a good one, both enrolled and non-enrolled patients. You only need 4. Now, I know with palliative care, it's a little hard to predict. If the patient, happens to be sick, then obviously they'll be available in this category. Terminal illness. Again, the K023 is probably the easiest one that you're going to build to get this. If you have 4 patients, $2,000 bonus. If you have 10, a $5,000 bonus. I know it's hard to say that within palliative care to have a bonus, but that's the nature of the job. And if you are providing care within this category to both non-enrolled and enrolled patients, you are eligible for a bonus. Home visits. Again, this is a tricky one. So depending on how frequently you're seeing your patients, you're going to have to see them, and both either in their home or in a facility or anything like that, and you're going to bill those codes you see on the side. Again, depending on the time you're seeing them, depending how many people you're seeing them, again, it gets a little bit more tricky and a little bit more complicated. So again, that would be a more specific question that you would have. And if you wanted to send me over some of the details around the home visits that you're providing to your patients, we will be able to give you a much clearer answer specific to you as to what you should bill, when you should bill it, and how much you're going to be getting for that bonus. Again, anywhere from $1,000 all the way up to $8,000. Again, both non-enrolled and enrolled patients. Long-term care. So this is a tricky one as well. Again, both enrolled and non-enrolled patients. In some cases, it does make sense. We always get the question, should I enroll them? Should I not enroll them? So for the bonus, it doesn't make a difference whether or not they're enrolled or not. However, we are seeing that it does make more financial sense lately to keep those patients enrolled, because you get your management fee, you get your capitation for that patient, and you get the shadow billing. If you're going to see them, a few times a month, it actually does make more sense to keep them rostered. And again, if you have more specific questions about that, happy to answer them. 12 or more patients served, $2,000 bonus. 36 or more, $5,000 bonus. And you'll see that W10 is probably the most common one that people are billing. But again, if you have a more specific question, let us know. Prenatal. This is an easy one that a lot of people just forget about because they feel as though they're shipping off the pregnant women to the OB and not necessarily providing care for them. But if you do have that initial visit with them and you told them that they're pregnant, or you have at least one visit to say this is what you should or shouldn't do, this is who I'm referring you to, you can bill the P003, which is the minor assessment, and you'll be able to count that towards your 5 patients or more to get that $2,000 bonus. And we do find that more and more people are getting that now because they're a little bit more aware of it. Serious mental illness. Now, I would venture to say that almost all of you will have 5 or 10 patients that are classified as bipolar or schizophrenic. The code for bipolar is Q020, and for schizophrenia, it's Q021. Best way to get this, create a list of all your patients within this category that are either bipolar or schizophrenic, and bill it once per year. It's a code that's a tracking code, not a billing code, so you don't have to worry about billing it when you see the patient. As long as you have that patient enrolled to your roster, you are eligible to get that bonus of $1,000 or $2,000. So let's talk a little bit about CMEs quickly. As I mentioned earlier, typically it's $2,400, or in the past it was $2,400. This year was only $400 for this fiscal year as of April 2015. If you did have any carryover from last year, you can still bill it. You're still within the 6 months, but you're getting very close. So go back and double check and make sure. The codes that are available, obviously it's the Q555, 556, or 557. Excuse me, they do put a limit on the 556. So easiest way to get around that and to make sure that you do get paid all your credits for the conferences that you're going to, or the readings that you're doing, or the teachings that you're doing, or all that extra curricular activities that you're doing for yourself to better yourself, build a Q557, which is considered other. And it's the easiest way to make sure that you're maximizing your CMEs and getting everything that's allocated to you. Again, it's on your RA, your solo RA, to show you if you had any carryover last year, what you were allocated at the start of this year, and then what you're allocated or what your current balance is moving forward. So take a look. Again, if you do have any questions, let me know, and I'd be happy to help you with that as well. So billing your CMEs, again, every billing software is different. Some of you may have to submit it by paper. We've had a few instances where for whatever reason the EMR won't allow the health card number to be blank or zeros or whatever the case is. So again, you can print off a form online and just submit it by paper. If you are going to submit it through your EMR, create a dummy patient, which I'm sure you have for your preventive care bonuses. Put in the date of birth, put in the patient name. Could be your name, your date of birth, not a big deal. And you submit that. So again, every 15 minutes is 1 unit of service paid out at $25. So for 1 hour, you're going to claim 4 units. And always put the code at $0, and it'll automatically pay out the correct amount. So as I said, easiest way, 557, because they do put a limit on the 556. And again, we're here to help in any way we can to make sure that they do get paid, or to make sure they're not rejected, or whatever the case is. So some of the key takeaways for today, obviously monitoring your special bonuses and premiums, making sure that you know what kind of care you're delivering, what bonus you should be getting, so on and so forth. So, we're happy to help. It's a great service that we provide to our clients twice a year, that we give them a report to say, midway through the year around now, we show them what they've done so far, especially for office procedures where you have to get to 1,200. Are they halfway there yet? Are they more? Did they receive it already? Everybody likes to know. It's sometimes hard for them to find it in the RA, so it's a great service that we provide. And then towards the end of the year, January, February, we give you an end-of-year update to show you if you've achieved everything, what is still yet to achieve, and make sure you get that in before the end of the fiscal year. Again, at the end of the fiscal year, March 31 is when you have to have them in by. Billing CMEs, always under a dummy patient, anything within the last 6 months. Again, any carryover from last year as well. And they do carry over for the 1 year. So anything from prior to that, obviously you wouldn't be able to get, but anything from the previous fiscal, which is the 2014-2015, you'll be able to claim. And again, as I said, here's our contact details. We have our general helpline and phone number, and then my specific details down below. You can give me an email or send me or leave me a voice message if I don't answer, and we'll be happy to get back to you as soon as possible. This presentation was recorded today, so if you do have any questions and you wanted to review something, let me know and I'd be happy to send you the recording, or if one of your colleagues or friends would like to see it, by all means, we'd be happy to send it to them as well. I hope everyone had a good time and was able to follow along and got all the information that they needed. We do provide the information at a very high level to, again, cater to everyone and everyone. If you have specific questions, please let me know, and I'd be happy to help you out. Thank you.
Participant has left the conference.
Josh.